Hi, I'm Caroline Newsome. I'm an attorney at Newsome Law. In this video, I will walk you through what happens after being diagnosed with locked-in syndrome and what patients and families can expect in the early stages of diagnosis. Hospitals will often treat the patient with stroke protocol first, as a stroke is much more common than locked-in syndrome. Until locked-in syndrome is diagnosed through testing such as an MRI or CT scan, a patient will be provided the necessary support to decrease the risk of health complications. Nurses and doctors watch closely for things like pressure sores, pneumonia, and urinary tract infections, which can develop quickly when someone is unable to move on their own. Standard ICU care also includes careful positioning of the body and passive range of motion exercises to prevent stiffness in the muscles. Families and medical professionals should have a conversation early on about long-term prognosis and goals of care. This stage can feel overwhelming, but setting clear expectations helps families make informed decisions moving forward. Once locked-in syndrome is diagnosed, treatment focuses on providing the rehabilitation and support that best meets individual needs. It is important to remember that no diagnosis of locked-in syndrome are alike. The goal of treatment at this stage is to support the individual's health, preserve their abilities, and help them find ways to communicate and interact with the world. Therapies are often intensive and may include speech and language therapy to help the person learn how to use eye movements or devices to communicate, physical therapy to maintain circulation, reduce stiffness, and keep muscles and joints as healthy as possible, occupational therapy, focused on practical daily tasks and adaptations for independence, even if those tasks look very different than before. Respiratory therapy is especially important if breathing support is needed or to help prevent lung infections. Swallowing and dietary therapy to help some patients relearn to swallow safely, while others may require a feeding tube or specialized diets. 24/7 care is needed to help with breathing, eating, and hygienic tasks. Doctors provide family members with training as caregivers if they choose, and this may include how to safely move the patient, how to use medical equipment, or how to manage a ventilator at home. Assistive equipment in the home can make a major difference. For example, lifts may be used to help safely transfer a person from a bed to a wheelchair, hospital beds that adjust positions, reduce pressure sores, and make daily life easier. Customized power wheelchairs may allow patients with some voluntary movement to get around more independently. Ventilators and other respiratory aids to support breathing and reduce the risk of complications. This kind of daily care is a team effort, often involving doctors, therapists, nurses, and loved ones working together. Improving the quality of life is just as important as medical care. One of the most important steps is to establish a communication system immediately. For some, that begins with a simple yes or no, answering through eye blinks. Others may move to word boards, eye tracking devices, or even brain-computer interfaces. Other ways to support quality of life include allowing the individual to take part in family decisions, helping them get out of the house whenever possible, whether that's attending an event, enjoying nature, or simply visiting with friends. Enrolling in social services that provide home health aides, counseling, or financial assistance. When patients feel seen and heard, their emotional health improves, which also benefits their physical well-being. If you or someone you know has been diagnosed with locked-in syndrome and have questions about medical care or legal rights, visit us at Newsome Law. We're here to help.